Hey everyone, thanks for coming back to my channel. I am your fave nurse B. So this video is for anyone who is in nursing school, interested in nursing. Maybe you're a CNA, you're a new CNA, you're an old CNA, or you're a new nurse, or you're in nursing school and you're doing fundamentals of nursing. I have this series for you all just to go over the basics, because sometimes, you know, we need to refresh or we need to learn the basics just more in depth, because it really is like the foundation or fundamentals of nursing. Today we're going to talk about your patient who has a G-tube or some type of tube feeding or artificial feeding that's given to them somewhere in their abdomen, okay, their stomach, some part of their stomach. Okay, so there's a few things you need to consider when your patient is on a tube feeding. So the first thing would be is what is the patient on the tube feeding 100%, or are they able to still take foods or liquids from mouth? So typically if you're at a hospital or a nursing home, they are supposed to put like a symbol above that person's bed, like somewhere in the room, showing you, is the person NPO, meaning they take nothing by mouth, nothing, no food, no fluids, no ice, no nothing. Or if they are able to still take food by mouth, what is the consistency? So say they get the tube feeding. As a nurse, you probably can give your patient a tube feeding like throughout the night, and they only take it throughout the night, and during the day we still want them to eat breakfast, lunch, and dinner, but they are really low on bringing in food, so we want to still give them food throughout the night to make sure they're still getting their nutritional and caloric needs met. So if they are eating food, you might have to see what is their consistency. Are they taking food the same way me and you do, regular consistency, or does it have to be mashed up like mechanical soft, or does it have to be puree, which is basically the consistency of like blended foods or pureed foods or like baby food? And then what are their fluids like? Is it like a thin liquid like me and you, or is it thickened? And if so, what is the consistency of that thickened liquid that they can take? So you have to know what your patient's status is as far as NPO, and if not NPO, what is the level of fluids and food that they can take in. So next, let's talk about the position of your patient. So say they're in the bed and their tube feeding is running. You need to realize that they are eating. So just think about me and you. If I was in bed eating, would I be laying all the way back flat, like trying to eat something or drink something? No, I would be sitting up eating my food. So when you have a patient who is on a tube feeding and it's running, you need to make sure that your patient is at least, I'm going to put the degrees here, I believe it's 45-degree angle, but don't quote me, but 35 to 45. So this is 45, sitting all the way straight up is 45 degrees, and then 35 is just a little bit lower than that. So I believe it's at least a 35 degree, but it depends on your facility. Things change in school, all this stuff freaking changes, but I'll leave everything down here. But have them at that degree at all times. Now, say you have to go in and you need to change your patient who's on a tube feeding, or you're the nurse and maybe you want to reposition your patient, or you have to do a wound on their backside or whatever. Turn that tube feeding off, put it on pause. Now, some facilities will not allow CNAs to pause the tube feeding. You will have to get a nurse to come in and pause it, but just know your facility. But that needs to be turned off before you do anything, because once again, they're eating. It's like you're trying to eat while you're flipping over in the bed and somebody's laying you down flat and messing with your butt and all that. No, you're not going to be able to get anything done. So do not move that patient out of that degree unless you pause the tube feeding. So you pause it, do what you have to do, and then make sure you turn it back on. The next thing you need to know is that there are some safety precautions. The reason why we're doing this is because, like I said, you don't lay flat and eat, because if you lay flat and eat, you can cause yourself to asphyxiate or to choke on your food. So this can literally be happening to your patient as this is going through their stomach. They could choke on their food, they can aspirate, can come back up and end up in their lungs. They can get pneumonia and get sick, get sent to the hospital, maybe even die. So you want to make sure that you are following these guidelines, these rules. It's here for a reason, for the health of our patients. Remember, even though some of this stuff is like, oh gosh, do I really got to do this? The biggest thing in healthcare that we want to do is to keep our patients safe and to cover our, okay. Next thing is, when it comes to positioning, this is super important. Say you go in there, you clean up your patient, you get them in the bed, make sure they are sitting up. So of course, like I said, you want them at a certain degree, right? But say you're at that certain degree and like my head is right here. Okay, the pillow's right here. It's the top of the bed. You know, okay, I'm good. I'm at a good degree. I'm getting my tube feeding. If you see that patient is slumped down in that bed like this, all the way slumped down in the bed, but hey, it's still the same degree, that they all like, no. Put them in the bed, position them well, and have them sitting up getting their tube feeding. Position your patients properly in the bed. It's going to keep them safe, you all. It's going to keep them healthy. It's going to prevent aspiration, okay? Prevent pneumonia. All right, so do that, as well as make sure that tube feeding, y'all, make sure that you are looking at the actual tube and that the tube is properly coming away from that patient. So I don't even have my stuffed animal in here today. If you watched the first video, I had my stuffed animal, but I don't even have it. But so say this is the tube feeding. Get over here. Say this is the tube feeding coming out of the patient. So if I'm in bed and I'm on my tube feeding, I'm getting my tube feeding, y'all, and it's in my belly and it's coming out, and you just reposition me in bed. And say like I'm laying in bed, I'm laying on my back, and the tube feeding is like this. It's hooked up to me, it's hooked up to the machine to give me my tube feeding, and it's kinked up behind me. What do you think is going to happen? At some point, if it's kinked, that patient could not be getting that tube feeding. It could back up. It could even pop out. And guess what? This tube feeding is still going to come out the machine. It could still come through, right? It could still come through at some point. And it'll be all over your bed. So you want to make sure your patient is not laying on the tube feeding, is not underneath them, and it's able to freely flow from that patient's abdomen up to the source of where the food is coming from, to that pole or whatever. So make sure that's the case. Make sure once you get your patient repositioned in the bed, make sure everything is still hooked up. If you're the nurse giving the medications to the patient, make sure you hook everything up back the way it needs to be hooked up, because your CNAs are going to be pissed at you. If you went in there, did your tube feeding or did whatever you had to do, and you came back and that tube feeding ran from out of the machine and now it's all over the patient's bed, they're going to be pissed. And also think about it, your patient probably didn't have food for like the past 3-4 hours. So that's not cool, especially if the only way they're eating is through the tube feeding. So keep that in mind. That's something so simple, but I see people leaving that tube feeding kinked up behind the patient. And when you're doing that, it's just putting them at greater risk of it coming out. So just the tube feeding coming out of the tube connected to them, or the entire tube that's in their stomach coming clean out. You don't want that at all. That sucks. It's not cute. That's a whole problem, and it can be very painful to your patients. Some patients, they don't really notice it though, from what I've seen, but it can still be painful to their patients. You might have to send them back out to the hospital depending on your facility's policy. So you want to prevent that, right? We don't want all this drama. So keep your patient positioned properly. Next thing I want you all to think about is if this patient is not taking anything in by mouth, they're not able to get anything in their mouth, more than likely their mouth is going to be super dry. So anybody who's on tube feeding, even if they still are able to eat foods, they need to have some type of swabs. So they have like those lemon swabs or whatever, sponge swabs. You just take them out of the packaging, put them in you can put them in some cold water, you know, just because it just feels like fresher and like, okay, cool. Put it in some cold water, put it through their mouth. Just say, I just want to clean your teeth. Put it through their mouth, clean their teeth, rub it against their gums, rub it against their tongue. And sometimes, you know, it really just helps them to feel better. Sometimes their mouth is extremely dry. So make sure you're doing that, cleaning out their mouth. And then also if they have something by their bed, put something on their lips, you know, it's just a way of making sure like your patients are taken care of and they feel more comfortable. Because just think about it, if you're not able to take food in, like, That sucks. Like, that really sucks. So you want to make them feel as comfortable as possible. So definitely make sure your patient has some type of swabs by their bed. If they don't have them, ask a nurse, ask somebody who does supplies to get those for your patients. They need those. And you should just be doing it maybe just once on your shift, or you're about to leave, do it real quick, or you come in for the day, do it real quick, just to help to refresh that area and to offer some type of moisture. So those are the tips that I have for you all. If you have a patient who is receiving some type of tube feeding, some type of artificial feeding, those are the tips that I have for you all. I hope you found them felt helpful. Go ahead in the comment section. Let me know what other videos do you want to see that help with the basic knowledge of nursing, that helps for CNAs and people who are in nursing school, and also for new nurses. I already had a video talking about using a Foley catheter and what you need to know as far as your patient when it comes to using a Foley catheter. Go check that out and let me know down below what else I should add to this series. If you are interested in nursing, consider subscribing. I have tons of videos. I have study videos. I even have my nursing school notes up for sale on my website. And if you're watching this in April 2020, they're on sale $5. So they're 50% off. Hydrate. I also have nursing school study templates up on my website. And yeah, that's that. Thank you all so much for watching. I really appreciate the views, the help, the likes, the comments, the shares. I appreciate every last one of you all. Thanks for watching.